Hello everyone. Today in this physiology video lecture class, we shall be discussing regarding one of the human common disorders, that is diabetes mellitus, and in association with this diabetes mellitus, another disease that we are discussing, in fact the disorder discussing is obesity. Okay, so causes, what are the symptoms, and can it be prevented, or it cannot be prevented, how it can be treated, what are the lifestyle changes, food habits, everything we shall discuss in this class. Let us get started. So with respect to diabetes mellitus, it is a chronic disorder which impairs the metabolism of the body. So the first important thing that is going to happen, it is a metabolic disorder. The condition of diabetes mellitus will impair the carbohydrate metabolism, protein metabolism, fat metabolism in the body. As a result, it leads to many complications. Now, one of the very important hormone that is present in, which is associated with diabetes mellitus, is the insulin. As we all know very well, insulin is involved in glucose metabolism of the body. This hormone, secreted by the beta cells of the pancreas, it converts the blood sugar into glycogen, and it will be stored inside the tissues. Okay, so to reduce or to regulate the blood sugar level, this hormone is very essential. Now, the diabetes mellitus is due to the insufficient or no secretion of insulin, or the body developing resistance to action of the insulin. Okay, so because of that, knowing about this hormone becomes very important. Why it is very important to learn regarding diabetes mellitus? Now, this is the disease today. It is responsible for many complications in humans, and not only that, it is highly prevalent and very much increasing nowadays in many countries, including our country. Okay, so once a person is recognized with diabetes mellitus, he's going to face many problems like the acidosis in the body. It may result in coma and lead to long-standing complications, and sometimes it may result in blindness due to retinal damage, and it may result in accelerated atherosclerosis due to the plasma LDL levels, and even it may result in stroke or myocardial infarction. Okay, so these are some of the complications that I have listed here, which result due to the diabetes mellitus. So it is very important for us to understand regarding this disease. Now, what happens during this disease when there is impairment of insulin secretion? Now, the glucose presence in the blood increases. There is increase in the amount of glucose that is present in the blood. Due to excessive glucose that is present in the blood, the kidneys start filtering as much as glucose possible in their glomeruli. As a result, we start seeing presence of glucose molecules in the urine also. Okay, so presence of glucose molecules in the urine again demands lot of water. As a result, the person goes for frequent urination. Okay, so these are the common things we do have an idea regarding diabetes mellitus. Okay, so let us try to understand what is the main cause of diabetes mellitus. Now, the first important cause of diabetes mellitus is, it is the inability of the beta cells of the islets of Langerhans present in the pancreas, endocrine pancreas. If they fail to produce insulin, then it results in diabetes mellitus. The other important reason for diabetes mellitus is the peripheral tissues of the body fail to uptake the insulin. Okay, so they lose their insulin sensitivity. As a result, there is presence of glucose in the blood, which results in diabetes mellitus. Apart from these two main reasons, we do have other reasons which are associated with some specific disease. For example, there is chronic pancreatitis or pancreatomy, or even Cushing syndrome and acromegaly also can result in diabetic condition. This condition we call usually as secondary diabetes, but the major cause for diabetes is the inability of the beta cells to produce insulin, or defects in the insulin uptake by the peripheral tissues. These are the two main causes for diabetes mellitus. Now, based on the type of causes, we have classified the diabetes into two types. One is type 1 diabetes, which is called insulin dependent diabetes mellitus. Another one is type 2 diabetes, which is called non insulin dependent diabetes mellitus. Okay, so these are the two types of diabetes mellitus that we see. Now, what is this? Let us see one by one. In case of type 1 diabetes, there is autoimmune destruction of the beta cells. The beta cells that are present in islets of Langerhans or pancreas, they get destroyed due to a specific type of protein that is present on these cells. It is a genetic problem where the body immune system acts against its own beta cells. As a result, the beta cells fail to produce insulin. Okay, so see, the immune response against the beta cells, as they recognize the beta cell protein that is present as the viral protein, and they start reacting against the beta cells, and this impairs the glucose metabolism of the body. So this usually results in people who are below 40 years. Because of that, it is also termed as juvenile diabetes. It can occur in any person of any age, usually below 40 years. Now, here in type 2 diabetes, the person who is suffering from diabetes mellitus is not obese. The diabetes mellitus type 1, it is not due to the excessive fat deposition in the body or due to the obese. They need not be obese. Still, they may become diabetic due to this autoimmune response of the body. But in spite of not having obesity, still they will be having a lot of ketosis and acidosis in the body. And they develop a emergency situation inside their body known as ketoacidosis. Now, because the type 1 diabetes has an autoimmune reason behind it, the type 1 diabetics do have a strong relationship with what is known as Graves' disease, Hashimoto's thyroiditis, and Addison's disease. In relation to this, also type 1 diabetes can be caused. And we do know very well the vitamin D plays a major role in pathogenesis and prevention of type 1 diabetes. After understanding the causes and the nature of type 1 diabetes, let us see the type 2 diabetes, which is non insulin dependent diabetes mellitus. Here, the main cause for the type 2 diabetes is either it is low amounts of insulin that is present in the blood, or it is the inability or improper insulin uptake by the peripheral cells, which we term it as insulin resistance. Okay. Now, the peripheral cells that are present in the body, they start developing the insulin resistance. One way, there may be very less amount of insulin that is produced by the beta cells, or the other way, the peripheral insulin resistance has been developed. Because of these two reasons, the person may have the type 2 diabetes. Now, it results usually, it is reported after 40 years, and the persons who are suffering from type 2 diabetes, they are usually overweight or obese, and their BMI, that is body mass index, it is 30 or even greater than that. So people who have the BMI 30 or greater than that, they are more prone to diabetes mellitus. Now, what happens when the cells develop insulin resistance? Due to developing insulin resistance, there is elevated fatty acids in the plasma, causes decrease in glucose transport into the muscle cells, as well as increased fat breakdown, subsequently leading to elevated hepatic glucose production. Okay, so even though there is um, proper insulin secretion, in spite of that, due to development of the insulin resistance, the body feels there is less glucose and it starts producing what is known as hepatic glucose. This condition increases the blood sugar level rapidly. And due to production of glucose inside the body, there may be even fasting hyperglycemia in case of type 2 diabetes. That means even when the person is not eaten, their blood sugar level will be very, very high. So that is regarding the type 1 and type 2 diabetes. Now, what happens when there is very high blood sugar level? What is the problem the body going to face when there is very high levels of blood sugar? Uh, Very high levels of blood sugar can result in what is known as heart attack and cardiovascular diseases like strokes. And it also may damage the nerves in the legs, resulting in what is known as neuropathy in the feet. So this problem leads to foot ulcers, various other infections, and even necrosis and amputations. So these are very serious complications of diabetes mellitus. And many diabetics, they do have what is known as diabetic retinopathy, which results due to the damage of fine blood vessels that are present supplying blood to the retina, and they may get damaged, which may result in permanent loss of vision. And due to the excessive blood sugar level, the kidneys continuously struggle to extract the glucose from the um, blood. As a result, the kidney cells may get damaged, so that may even result in kidney failure. And in males, it may result in erectile dysfunction, and very significantly, the diabetes weakens the immune system. This is an invitation for many complications. And even in the present pandemic of COVID 19, we are also coming to know that the diabetes mellitus patients who have been infected with COVID-19 virus, they have the more risk of getting infected with mucormycosis, or what we call it as black fungus. It is due to the reduced immune system. So these are the complications of high blood sugar. Now, how one recognizes that the person may be suffering from the diabetes mellitus, or in fact to say what are the symptoms. So these are the symptoms like increased thirst, very frequent urination, blurred vision, fatigue, weight loss, sores and infections that heal very, very slow. Before they used to heal very fast, now it becomes very slow, and increased hunger and darkness on the skin. These are the symptoms of diabetes mellitus. Now, how do we diagnose diabetes mellitus? There are four important tests that are associated with diabetes mellitus. Number one, A1C test. So A1C is nothing but glycosylated hemoglobin. So now in the blood, when the glucose is excessively present, it usually attaches to the hemoglobin molecules, RBCs. Okay. Now we can, through A1C test, we can calculate the amount of glucose that is attached to the RBCs, and this shows for a long period of time what was the blood sugar level of the person. And there is another test called random blood sugar level. Anytime it can be done. So immediately, what is the presence of glucose level in the blood that can be recognized. And if the a physician want to know whether there is usual increase in the blood sugar level even when the person has not eaten the foods that are going to increase the blood sugar level, then they go for what is known as fasting blood sugar. Usually it is done in the early morning when the person has not eaten anything for last 12 hours. And there is another test which is usually done in case of pregnant women to see how, to what level the blood sugar level spikes up when there is rapid intake of the glucose increasing food like glucose solution. So the person will be fed with the glucose, and within 2 hours, their glucose test will be done to understand the glucose spike in the body. Okay, so these are the four important tests that are done in order to identify diabetes. Now we have understood the causes, symptoms, and the diagnostic methods for diabetes. Now let us see how to prevent this. Another disease, another disorder, which is very much cause of diabetes is obesity. We are going to discuss regarding this. Now, in order to prevent diabetes, so one need to reduce the sugar intake and include lot of vegetables and fruits in their food, and exercising will help them. But in case of type 1 diabetes, as it is an autoimmune system problem, it is not preventable. If it is programmed to happen, it is going to happen, but it can be managed. Then, most of the diabetes, it is the type 2 diabetes, which can be easily managed through diet and fitness routine. Next. So as I have told you, the type 1 diabetes, it is not preventable because it is genetic. Now the type 2 diabetes, it is very much preventable. Now these are the few measures that one can take to prevent the incidence of type 2 diabetes. Number one, so usually 150 minutes of physical exercise per week minimum of physical exercise per week is recommended, and they should be cut on eating more saturated and trans fats, and along with refined carbohydrates, they should not be eaten along with our food. Now, eating more fruits, more vegetables, and whole grains will help us prevent diabetes. And usually, we need to prevent eating more at a time. Stuffing our tummy with a lot of food at a time, that has to be avoided. Instead of that, we can go for having small meal frequently in the day to maintain the blood sugar level constant. If the person thinks he is overweight or obese, it is advisable to reduce the body weight by 7% of their weight. And these habits, they are like invitation to the diabetes and cardiovascular diseases. Now, because the type 1 diabetes is not preventable, it can be treated. What are the treatment options available for a person suffering from type 1 diabetes? Now, the solution for them is providing insulin externally. There are four types of insulin that are usually provided. Number one, rapid acting insulin, which starts its work immediately within 15 minutes and lasts for 3 to 4 hours. Short acting insulin, which starts its work in 30 minutes, lasts for 6 to 8 hours. And intermediate acting insulin starts work within 1 to 2 hours and lasts for 12 to 18 hours. Okay, and there are long acting insulin which starts its work in few hours after injecting, and the effect of which lasts for 24 hours. This is a treatment we see in case of type 1 diabetes. Now, type 2 diabetes usually it can be managed through diet and exercise, but when the blood sugar level continuously increases, the medication is the necessity. Now, through diet, we can control diabetes. Now, the type 1 diabetes, the person one has to reduce intake of more sugar into the body and control the blood sugar level. To do that, he has to avoid starchy or sugar foods and make sure the blood sugar level should not spike up rapidly. Okay, and the diet should contain protein, fat, and carbohydrates in the right balance. So, type 2 diabetes, again, I told you diet and exercise, a fitness routine can very much prevent the type 2 diabetes. If the person is suffering from type 2 diabetes, again, one has to reduce the carbohydrate intake to avoid spiking of the blood sugar level, and the person should eat small meals throughout the day in a frequent slots instead of eating over amount of food at a time. And food should have more of fruits, vegetables, whole grains, and lean proteins such as poultry, fish, and healthy fats such as olive oil and nuts can help the person to manage with the type 2 diabetes. Now, the diabetes is very much increasing nowadays due to this problem of overweight or obesity. Now, the people who are obese, they have more and more chances of becoming diabetes. Okay, so a small exercise, even in a day, can prevent the person's chances of getting diabetes mellitus. Now, one of the major causes or major reasons for high incidence of diabetes nowadays is obesity. What is this obesity? Obesity is the excessive accumulation of fat or excessive deposition of fat in the adipose tissue of the body. Now, the body starts depositing excessive fat. As a result, the person weight starts gaining. This causes many metabolic issues. Now, because one of the major problem happens with the fat deposition is the body loses insulin sensitivity. It is going to have less insulin sensitivity. Less insulin sensitivity increases the blood sugar level, ultimately result in diabetes mellitus. Okay. Now we see the deposition of fat in case of women in hips and thighs, um, and stomach, and in men it is in belly and the waist. This has to be reduced through the fitness routine. Now you can see here reducing body weight even by small amount can reduce the um, chances of getting diabetes mellitus. So if one avoids the chance of getting diabetes mellitus, it is easier for him to manage with other complications of cardiovascular problems, metabolic disorders can be avoided by managing the body weight. Now, what is the method of measuring the obesity? The obesity can be measured through this formula where the person's weight in kilograms has to be divided by square of the height in meters. So, weight divided by height in meters. This should be in kg. Now, this should be less than 25. This ratio should be less than 25. Okay, so then the person is safe. If it crosses 25, it is 30 or above, then the person is going to be more prone to diabetes mellitus. Now, as I have told you, more deposition of fat in the body increases production of what are known as cytokines, tumor necrosis factor A, and retinol binding proteins. All this result in insulin resistance. One of the causes for diabetes mellitus. The body loses its sensitivity to insulin. As a result, there is chances of a person getting diabetes mellitus, and this also results in deposition of fat in other than adipose tissues like liver and skeletal muscles, which is a major cause for diabetes. Now, with this information regarding diabetes and obesity, we all need to know about these two diseases, because they are the major complications today leading to many health risk factors. Uh, uh, as we have discussed in this video lecture, diabetes is of two types, type 1 and type 2 diabetes. It is autoimmune problem where our immune system acts against the beta cells of the pancreas, and here in type 2 diabetes, there the beta cells have inability to produce insulin, or the peripheral tissues develop what is known as peripheral insulin resistance. The body loses the insulin sensitivity, as a result results in type 2 diabetes. Now, the type 1 diabetes has to be treated with insulin treatment, and type 2 diabetes very much preventable, and if one gets it, um, one can manage it through exercise and proper healthy diet. Okay, so and the symptoms are similar in both the cases. Okay, so that's it. Thank you for watching. These are the